I want to be a pharmacist because I really think we can make an impact in the healthcare field, specifically if we're part of the medical team. When pharmacists are part of the medical team, we improve outcomes, we decrease costs, we're very accessible to patients, so being a part of that team really can make a difference for our patients. Well, I work at a community pharmacy. We're a community pharmacy inside of a grocery store. We don't actually stock any of the over-the-counter items, but a lot of times customers will come up and ask for, where things are most of the time, but we still provide those recommendations, try to find them for them, and then sometimes they actually ask for over-the-counter recommendations, and we do try to provide that. So one afternoon I had an elderly lady come up to me and she was asking where the multivitamins were. So I walked over to the space there for her and pointed out where the multivitamins were, and she said she was looking for a chewable vitamin. So we found those, we're good to go, and I started talking to her, and she was actually purchasing these for her husband because her husband likes to chew all of his medications. Now, if you do or do not know, sometimes when medications are chewed, it can be very dangerous. For instance, medications that are supposed to work over a whole day, if they're extended release, some of them are over 12 hours, 24 hours, and if you chew the medications, it releases it all right away. So if that happens, then that can be very dangerous. It can increase dose very instantly. So I had to talk with her, explain that a little bit. Fortunately, she already had talked to a pharmacist about that, so she was well aware of kind of the risks, and she gets to sit there and watch her husband take his medications, make sure he swallows them and not chews them. Pharmacists deserve provider status because we really can make an impact for our patients. With provider status, we will be able to provide a lot more services, and again, we are way more accessible than a lot of other healthcare professionals. People seem to see their pharmacist about 5 times more often over a year than their primary care physician. So they're going to pick up their medications if they're sick and they got an antibiotic, they're going to come pick that up for the pharmacy, and that's a great opportunity for the pharmacist to counsel not only on that antibiotic but also on their maintenance medications. We can look for interactions, we can manage medications, and provider status will just allow us to do that better.